Hi everyone! I'm so excited because today we're having a very special guest drug. And right now, it is my pleasure to introduce to you the generic drug ALPROSTADIL.
Hi everyone, and thank you so much for inviting me here.
Hi ALPROSTADIL, how are you today?
I'm doing great, miss. I'm just working well on the male populace.
So besides your generic name, what are the other names that you are known for?
Well, I'm developed by companies. I'm known for certain brand names like Coverjet Impulse, Edex, and Muse.
Okay, so ALPROSTADIL, what are your uses and how are you classified?
I am pharmacologically classified as prostaglandin, which therapeutically aids as a vasodilator and works as an agent for impotence or erectile dysfunction. And since I am only used by the male populace, my pregnancy category is not applicable.
Oh, so you are a vasodilator.
Yes.
Can you enlighten us what a vasodilator is?
We, as vasodilators, relax the smooth muscles in blood vessels, which causes the blood vessels to dilate.
Do you work and what is your mechanism of action?
I am administered through intracavernosal injection in where I act locally to relax the vascular smooth muscle of the corpora cavernosa and cavernosal arteries. When these arteries dilate, the blood supply rapidly flow into the corpus cavernosum, which causes the expansion of lacunar spaces, and as sinusoids compress against tunica albuginea, the entrapped blood reduces the venous blood outflow, resulting in penile erection.
How does the body respond on you or your pharmacokinetics?
I am absorbed through intracavernosal injection, in which the absolute bioavailability has not been determined. I bind on plasma proteins, primarily 81% on albumin, and is rapidly converted into compounds that are then further metabolized in the liver. I am then excreted in the kidney through urine and feces on intestines.
So, what is your purpose?
I am indicated for penile erectile dysfunction, which could be due to neurogenic, vasculogenic, psychogenic, or mixed etiology. I am contraindicated to patients with any anatomical obstruction or condition should not be given with alprostadil as it will predispose to priapism. Patients with penile implants, patients with bleeding disorder, hepatic and renal disorder, optic neuropathy, and cardiovascular diseases.
I've heard that you have these effects that are a disadvantage to your patient. What are these?
Yes, I have local adverse effects in where I sometimes cause penile pain, priapism, inguinal hernia, and prostate disorder. As for the other systems, I cause respiratory tract infection and sinusitis in the respiratory system. For the musculoskeletal system, I sometimes cause back and leg pain. When it comes to the cardiovascular system, I can cause an adverse effect like hypertension, myocardial infarction, and abnormal ECG. For the metabolic system's adverse effect, I can sometimes cause hyperglycemia, hypertriglyceridemia, and hypercholesterolemia. I also cause an adverse effect in the integumentary system like skin disorder, and as for the special senses, I cause an adverse effect like abnormal vision to my client.
What are the nurse's responsibilities before, during, and after with regards to your drug role?
Before the nurse administers me, the nurse would first assess the client for any condition which could be a caution or contraindication when administering me. She should check for the history of allergies to any of the preparations, penile structural abnormalities, penile implants, bleeding disorders, active peptic ulcer, coronary artery disease, hypotension or severe hypertension, congenital prolonged QT interval, or severe hepatic or renal disorders. After that, the nurse will assess the baseline status of the client before administering the therapy to determine any potential adverse effects. The nurse will then assess the skin and lesions to monitor any adverse reactions on me and cardiovascular perfusion. The nurse will then monitor the orientation, affect, and reflexes of the client. This is to evaluate the CNS changes that might be related to changes in blood pressure and blood flow. The nurse will assess the pulse, blood pressure and respiration, and adventitious sounds to evaluate blood flow and potential changes in cardiovascular function. She will then assess and inspect the penis to evaluate local reaction to injection and to monitor for potential infection. The nurse will then evaluate the laboratory tests for bleeding time and liver function to monitor the potential adverse effects on the liver. As for the nursing diagnosis related to the application of me, the therapy will include the following. There will be a disturbance in the body image related to my effects and indication. There will also be an acute pain related to the injection of me. The nurse will also diagnose sexual dysfunction and a deficient knowledge regarding drug therapy. The nurse will then monitor the orientation, affect, and reflexes of the client. This is to evaluate the CNS changes that might be related to changes in blood pressure and blood flow. The nurse will assess the pulse, blood pressure and respiration, and adventitious sounds to evaluate blood flow and potential changes in cardiovascular function. She will then assess and inspect the penis to evaluate local reaction to injection and to monitor for potential infection. The nurse will then evaluate the laboratory tests for bleeding time and liver function to monitor the potential adverse effects on the liver. As for the nursing diagnosis related to the application of me, the therapy will include the following. There will be a disturbance in the body image related to my effects and indication. There will also be an acute pain related to the injection of me. The nurse will also diagnose sexual dysfunction and a deficient knowledge regarding drug therapy. For the planning phase, the patient will receive the best therapeutic effect from the drug therapy. The patient will have limited adverse effect to the drug therapy, and the patient will have an understanding on the drug therapy, adverse effects to anticipate, and measures to relieve discomfort and improve safety. During the implementation, the nurse will be able to assess the cause of dysfunction before beginning the therapy to ensure appropriate use of me as a drug. She will also monitor patients with vascular disease for any sign of exacerbation so that I can be discontinued before severe adverse effects occur. The nurse will instruct the patient in the injection of me, my storage, filling of the syringe, sterile technique, site rotation, and proper disposal of needles to ensure safe and proper administration. For the evaluation, the nurse will monitor the patient's response on me, like improvement in penile erection. She will also monitor for the adverse effects like dizziness, flushing, local inflammation or infection, fibrosis, diarrhea, and dyspepsia. The nurse will evaluate the effectiveness of teaching plan where the patient will have an understanding about me, my dosage, adverse effects to watch out for, and specific measures to avoid them. The patient can demonstrate proper administration of me. She will be able to monitor the effectiveness of comfort measures and compliance with regimen.
What will be your advice to the male populace?
This is all that I can say to them. When you plan to use me, have your medical checkup. Then try to weigh the advantages and disadvantages. If the advantages outweigh the disadvantages, then go for it. But if you think that your life may be endangered, then have your second thoughts.
Thank you for sharing this moment with us, Aprostadil. Everyone, let's give Aprostadil a round of applause, please. And thank you to you too. Have a great day.